Calamina, Calamina, Calamina. Good morning, good morning, good morning. Well, can you believe it's the 1st of December today? Where has November gone? And we are now obviously on the lead up now to Christmas. So if you've got an advent calendar, today's the day to open your first little window. Well, looking at the weather today after yesterday, where the weather was really mixed yesterday, I got absolutely drenched going into town yesterday to go and pick up my hard drive that I had a few issues with. And thank God, thank you, TechBox. You are stars, sir. You and your guys in that shop. You saved my life yesterday, I've got to be quite honest. And then obviously coming back to do a bit of an emergency broadcast after Mr. Takis's announcement about the over 60s will be vaccinated and they will also receive €100 fine for not booking an appointment by the 16th of January. Well, I'll be just talking about that in a little while. But anyway, let's just have a look at the weather at the moment. I've got to be honest, Jane and I were up early this morning, off again to the vets to take one of the little cats. In fact, that little fella there, Mr. Pickles, just for a quick checkup. And the weather this morning, lovely bright sunshine. The washing is on, just to let you know. However, the gloom clouds are hanging around. Can I thank Amanda for a concise weather forecast? She said, morning, Ginge. Today it's going to be mainly sunny with cloud. Although it's bitterly cold, it's going to be 16 today and it's going to feel like 16. I've got to be honest, the sun is now starting to poke through again and it's feeling quite nice at the moment as well, just out here. But I'm not going to be doing the news out here. I'm going to be doing the news inside. Quick shout out to Amanda Gregory as well, who's watching. Also, Ian Wallace is watching as well. Thank you for tuning in, guys. And there's a few others whose names that I can't see at the moment. But anyway, that's a weather forecast. Let's just go in and look at what's been going on in the last 24 hours here in Greece. I'll quickly switch the screen round. And there we go. So, right. Here is the news in the last 24 hours. In fact, let's get comfortable while I do this. I've got to warn you now, it's going to be a bit COVID heavy this morning. Can I just say a quick hello to the lovely Lorraine from Greece's Bulletin Board. Congratulations on your 3rd wedding anniversary. I know you were doing some special celebrations today. And also thank you for also taking my feed as well on my morning show. So anyway, you guys have a great day today. All right. Right. Let's have a look at the infection rate in the last 24 hours in Greece. To be honest, the infection rate has gone up again. Yesterday I reported 6,677. Today I report 7,486. That brings the total up to now 931,183. We're not far off 1 million at the moment, and will we reach the 1 million before Christmas? We shall wait and see. Anyway, 3 cases were identified after checks into the country on the 11th, the day before. So the numbers are down and infection coming through the borders. And trust me, they'll be checking the borders, especially with all the panic over the Omicron variant, which seems to be taking over most of the news at the moment. Anyway, when we're looking at cases on the islands, again, Lefkada yesterday, they recorded 3 new infections there, which was down on the day before where they had 4. Corfu, unfortunately, they've recorded 124 new infections, which was up on the day before where they recorded 91. Once again, just remind you that Corfu is in the dark red, Lefkada is in green. When it comes to Kefalonia, they have recorded 9 new cases, which was down on the day before where they recorded 10. They are in yellow. And us, Zakynthos, we recorded 26 new infections here on the island, which is up on the day before where we had recorded 15. And we are in the amber at the moment. Now, looking at the numbers for the month of November, from when I started doing my podcasts again, Zakynthos has had 388 cases for the month of November. Unfortunately, the previous month before that was August when I had numbers in, which was about 376. However, again, the numbers have been going up and down with our epidemiology here on Zakynthos. So again, it'll be interesting to see what the comparison is for December if things are still running in December, which undoubtedly they still will be with the way everything is being hyped up again just before Christmas. And again, it'll be just interesting to keep a track on our total infections for the whole of the year in comparison to last year, because I still have the figures for last year, but that's by the by. Anyway, when it comes to deaths, some good news on the deaths, although not for the people concerned. The death rate had dropped yesterday. 104 were reported on my previous report. Today I can report 88 new deaths across the country. Again, 95% of those had underlying diseases or were over the age of 70. And again, none of these deaths at the moment have been attributed to the Omicron mutation. That has still not arrived here in Greece yet at the moment. But let's make this clear. At the moment, we haven't had it arrive yet, all right? But none of those deaths has been attributed to that variant either. So it's all other variants. When it comes to ICUs at the moment, that number has also crept up again. 657 was the number I gave to you yesterday. Today, 664. Of that 664, 399 are male, 265 are female. The average age is 64, and 80.3% of them have underlying health issues or are over the age of 70. Now, regarding vaccination of those people, 532 of them are unvaccinated or partially vaccinated, and 132 of them are fully vaccinated. Again, as I said yesterday, when are they going to change partially and unvaccinated to vaccinated? Are they going to follow the same thing the UK is talking about following, where once you've had 3 jabs, you are then classed as fully vaccinated? If you haven't had 3 jabs, then you are partially vaccinated. But we'll wait and see. It's still early days in that sector at the moment. Right, the news at the moment, I'm not going to give you any UK news. I'm just going to concentrate solely on what's been happening here in Greece, because as you're probably aware from my little extra broadcast I did yesterday lunchtime, unvaccinated people over the age of 60 now must book a coronavirus vaccine appointment by January the 16th. Or face a monthly €100 fine. That's what the Prime Minister was telling his cabinet yesterday. Now, an estimated 520,000 people over the age of 60 remain unvaccinated here in Greece. The administrative fine will be automatically charged via an independent authority for the public revenue. Now, the way I see this money being charged, and I was discussing this with people yesterday in the UK, is this has been a very subtle build towards the point that we are at the moment. You may remember that during the summer, unvaccinated people had to test twice a week if they were working with the general public. So immediately a record was being kept then of those people that were not being vaccinated. Plus as well, your result that you had from your tests was going on your tax return, on your taxes net, which the government now has really ramped up. So that means they already know who the people are that have not been vaccinated. And basically, you've been telling the government since last year or since the summer of this year that you're unvaccinated because you've been testing. You've either had to physically put this into your taxes net at the beginning, and then when the government decided that they were going to give some of the make you pay for this yourself, when you went for testing at a test centre, the test centre had the responsibility to annotate your taxes net entry to say that you had been tested, whether you were positive or negative at the time. So this means that the government is already one step ahead. I see what will happen is this, is that you will pay your accountant and give them the money to go and pay the fine. That's not been ironed out yet. That's not been made official or public, but that is the way I feel is what they're going to do. The money will be collected through your tax. And so you'll be making a monthly visit to your accountant, giving them €100. They will take the money and they will obviously enter that onto your taxes net. And that will be proof that your fine has been paid. If, like me, you're prepared to pay the fine. All right. But we're going to wait and see what the finer detail of that at the moment. Anyway, the penalties then, as they said, are part of the government's effort to boost vaccination levels as it grapples with the surge in cases and anxiety over the Omicron variant ahead of the holiday season. Now, the only anxiety I'm seeing at the moment is through the media and through the governments. They are pushing this agenda at the moment. When you consider at the moment, we've not had any cases here. I think at the last count, there was 11 cases in the UK. Worldwide, at one point, there was only something like 50 odd cases. And this Omicron variant has been pushed to the front. And again, I posted yesterday up online from a lady who was involved with the actual discovery of this variant that it is not as deadly as what it's been said. It is affecting younger people mainly, not older people. It's a less virulent version, as in it is more of a killer. However, it does seem to at the moment affect most people, and they get over it. It's not the end of the world in some respects. And also, again, the vaccines that at the moment, they're still not 100% sure whether these vaccines are 100% protection against this new variant. But again, the pharmaceutical companies have already turned around and said, oh, don't worry, we've got new vaccines on the way within 100 days, which will deal with this Omicron variant. And don't forget, there's been a lot more variants before the Omicron. So why choose this variant as, the one that is going to end the world in the eyes of the governments and also in the eyes of the media? Anyway, they also said as well about 63% of the Greek population is fully vaccinated, although vaccine appointments have picked up in recent weeks. And I'll come on to another story connected with vaccine appointments in a while. Mitsotakis acknowledged that the measure will be unpopular even among the more vulnerable individuals, however, adding it will save lives. However, it's very unpopular with the likes of me, who's already had COVID, got better from COVID, does not want to be vaccinated, and is prepared to take the risk that my immune system is strong enough to fight the Omicron and my T cells in my body are just as effective. However, I am not saying don't have the vaccine. I leave that up to you. And as I've said all before, this is your choice and should be your decision whether you have the vaccine or not. And don't forget, there are some people who are not able to have the vaccine. And I was speaking to some people in that situation yesterday. They aren't able to have the vaccine. For them, having the vaccine is probably a death sentence for them, and they don't want it. All right. So again, we'll see what systems are put in place for those people who, for medical reasons, just can't have the vaccine, full stop. Anyway, Mitsotakis acknowledged that the measure will be, I've done that, yeah. He said, we are focusing our efforts on protection of our fellow citizens, and for this reason, their vaccination will be mandatory from now on. Anyway, he also said the government is put on high alert over the new possibility, more infectious Omicron strain of the coronavirus, which just days after being discovered in South Africa is popping up in European nations. Yes, it is popping up. However, just how deadly it is, we are still yet to see, shall we say. Anyway, at the moment, again, no cases of the Omicron variant have been detected in Greece up until late Monday. I know today is Wednesday, and there's been nothing in the press this morning that backs up that story. Anyway, the government has logged 931,183 infections, 18,067 deaths since the outbreak of the pandemic. And those numbers are obviously the numbers just from the other day. Anyway, interestingly then, just to back up Mitsotakis's push to make mandatory vaccinations for 60-year-olds, the constitutionality of making COVID-19 vaccinations mandatory for people aged 60 and over is not in doubt. And a law professor said on Tuesday, Anyway, speaking to Sky, Greek Sky that is, Antonis Makis cited relevant rulings by the Council of State and the European courts, including the European Court of Human Rights, confirming the constitutionality of compulsory vaccination for certain categories of workers. He says their freedom is not being violated, especially when dozens of lives a day can be saved in this way. He also said, if no action is taken, a large percentage of this age group will continue to die. It is therefore justified to infringe on one asset to increase the rate of immunity when humans' lives can be saved. The protection of life is supreme asset. Now, I can understand where he's coming from in some respects, but on the other respect, if we've already got 65% of the population already vaccinated and people have chosen to have the vaccine, that's well and good. But for the greater good to say, I'm going to forcibly vaccinate you for the greater good of the country, I'm sorry, it still smacks of a dictatorship. And it also it smacks of a split in society between the vaccinated and the unvaccinated. And I say this is the slippery slope of control. This is where you're doing as you're told and be damned. And when you think about what's gone on in other countries as well, especially in the likes of Austria and places like that, where people, again, mandatory vaccination is now coming in for everybody in Germany, it says to you, why, oh, why are you pushing this vaccination agenda when at the end of the day, this new variant is no more deadly at the moment? Yes, it spreads quicker, but the people who are getting it, their symptoms are not as bad as with the other one. And again, the virus wants to survive at the end of the day. And trust me, the virus is mutating and changing all the time, like the common cold, like flu. We just got to learn to live with it. But you need a certain amount of herd immunity within the system. Young children need to get their bodies exposed so that they're able to get it within their own systems naturally to be able to fight off these new variants that are going to appear. Because where is it going to stop? Is there going to be another variant, another variant, another variant? More vaccines being used, more vaccines being used. And when you consider that Greece has given 155,000 doses of the vaccine to Ghana, all right, is that meaning that our old stock is now being passed on to other nations so that we can buy new stock for a new variant that comes along? This is going to be, I see it, an ever circle that's just going to go round and round and round. But at the end of the day, you should have your choice as to whether you have that injected into your system. Anyway, he also went on to say this. He said, if no action is taken, a large percentage of people of this age group will continue to die. It is therefore justified to infringe on one asset to increase the rate of immunity when human lives can be saved. I don't like using the word asset. It should be one asset of one of your freedoms, all right? Not the word asset. That makes you sound like a commodity, basically, at the end of the day. Anyway, and the protection of life is supreme. Now, the imposition of the financial sanctions was absolutely necessary and appropriate. He continued, no one can claim that 100 euros is coercive measure. Well, is that not coercion in itself? So again, he's talking bollocks as far as I'm concerned. Assuming that low-level wage earners cannot afford it, they can be vaccinated. So to me, that's a very cynical statement. If you can't afford it, your option is then go and get vaccinated. And there will be people that can't afford it. And to be honest, they're being coerced into being vaccinated. There's no freedom in that. It is a dictatorship, and it's not only happening here in Greece. I can see this happening in other European countries, and it won't just be for the over 60s. It will be for everybody, because at the end of the day, this madness has still got to be paid for. And we were sat doing the maths yesterday. It's about 5 million euros a week a month, that will probably be collected if that 500,000 people decided not to have the injection and were happy to pay the fine. But we'll see how many people are prepared to pay the fine, or whether people will just fold, just give in and just accept the inevitable. But again, we shall wait and see on that score. In any case, he then went on to say the state has exhausted all measures. It avoided all compulsory vaccination from April and March, preferring the strategy of persuasion and the option of vaccination when the opposition demanded that the entire population be vaccinated. So now what they're doing is basically saying it's been a good thing. We've exhausted all men. Listen, if you've exhausted everything, why not let the vaccinated be, the unvaccinated be? If they don't want to be vaccinated, great, fantastic. Let's get some herd immunity going as well as vaccinated immunity as well. The two might rub off on each other. And again, it's about common freedom. It's about your right to decide what you want to do with your body and not be bribed, coerced, threatened, and had your liberty taken away, basically, because we're doing this for your safety, all right? And that patronising tone just is another thing that just really grabs me and annoys the hell out of me. Anyway, adding to the patronism, all right, from the Greek government, the provision of 2 self-free tests now are going to be given to the entire adult population in order to track, the wording track, the population for the coronavirus cases. Now, the Prime Minister Mitsotakis announced this yesterday as a parallel introduction with the compulsory vaccination of 60-year-olds. Anyway, he said 1 self-test will be available before Christmas. So here's a Christmas present from the state, a free test. Oh, thank you, Mr. Mitsotakis. What's happening about ICA this year? We've not heard nothing about that and about what people are going to get in their ICA, but you're going to give us a free test. So we know all about that, but nothing about what's going on with ICA. But that's by the by. Oh, and we're going to get another one in New Year as a nice New Year's present as well. Oh, how thoughtful, how kind you are, sir. Anyway, in view of the holidays, the state is, I like that, in view of the holidays, the state is taking another complementary measure from December the 6th to the 12th. It will provide free self-tests to any adult, vaccinated or not. Oh, thank you, sir. I doff my cap to you. To identify possible asymptomatic carriers of the virus before Christmas. Exactly the same exercise will be repeated on the 3rd to the 7th of January. Just a week before you've got to get your compulsory vaccination for your over 60s, or get your wallet out ready to pay your first €100, and to follow the course of transmission of the pandemic during the holidays, because it is important that we all control ourselves during the gathering of the day. Oh, too many people in your house, too many people having fun, or you could spread it, or we could be in a lockdown by then, and we all know lockdowns don't work, do they? And detailed announcements will be made today by the Minister of Health, while we have secured through the civil protection another 20 million self-tests for the needs of our schools. How many people have got self-tests in their cupboards, in their fridges? I think we've got a few in ours that have been given away, which haven't yet been used, or they've been saved because you want to travel somewhere. So it looks like these self-tests that are going to be given away, are you going to be self-testing people there and then? So when you collect your sample, because this is the way that you will track people, it's not giving them another one to go in the cupboard or go in the fridge for when they want to use it. Are you actually going to self-test people as opposed to give away a vaccination tool as well? Anyway, let's move on to another subject. Let's look at the opposition party here in Greece, SYRIZA. Now, the government's management of the coronavirus pandemic, according to the main opposition leader, which is Alexis Tsipras, who used to be the prime minister before the last election, he says the coronavirus pandemic lacks planning and strategy and is sloppy. Anyway, during a meeting with the National Federation of Public Hospital Staff, Tsipras gave his reaction to the measures announced earlier to make vaccination mandatory for citizens aged 60 and over. Those who fail to comply face the €100 each month from January the 16th. Now, Tsipras has accused the Greek Prime Minister, Mr. Mitsotakis, of being a vaccination saboteur. Because instead of expanding vaccination rates in the population as everyone hoped, we will have to have a wave of reaction that will not help anyone. The main opposition leader expressed concern over the pressure on public health system with the continuing spike of infections, hospital admissions and deaths, adding that the measures were wrong. Instead of imposing fines, it would be better to encourage, even with financial incentives, those to take the first and third doses, Tsipras said, calling for an awareness campaign. Anyway, we must convince people of the value of vaccinations to save lives and not take half their pension in fines. Anyway, he also criticised the lack of measure to combat crowding in public transport. The president of the Hospital Workers Association described the situation as being out of control and that patients slated for ICUs are chosen on the basis of age. The remaining staff is less than 9,000. You've got to remember they sacked loads of people because they wouldn't have the vaccination, the same as they did in the UK. And he said that we had we have 9,000 less workers than we had last winter, and has surrendered and can't take anyone. They wear high protection suits for 8 hours a day straight. Yeah. Right, now, let's get this clear. The opposition party, in some ways, is right about encouragement rather than trying to bully people into having it. But I still feel it's got to be your choice whether you have it or not. It's up to you whether you get the vaccination or not. It would be a case of you make that choice. That's it. And then if those people are ill, they're ill. Majority of people who have had the virus have got over it. And when you look at our epidemiology rates for Greece, ours have been some of the lowest in the EU. Even when it's adjusted for mathematically for comparison between nations, our epidemiology rate has been very low. Our death rate has been very low. 18,000, a population of 11 million. All right. How many people have died of heart attack, strokes, have had other illnesses like cancer? Some of them have been going untreated. Another thing is this year, Jane and I here in Zakynthos, I've never known a year where we've seen so many deaths of people that we know. And the thing is, none of them have died of COVID. They've all died of cancers, strokes, accidents, etc. But none of them that we know have died from COVID, either directly or even indirectly, because they decide to stick that on the death certificate because they had a snuffle or a sniffle when they passed, as in the case in the UK, where they were counting winter deaths from flu and sticking it down as a COVID death just to hype the numbers up and make the situation appear worse than what it was. So again, I just say to Mr. Tsipras, what you should be doing at the moment is saying, right, fine. The people who don't want to be vaccinated have made that decision. Great. Let's concentrate on those that maybe have been vaccinated. Leave those other people. We could be just a big experiment, basically, at the end of the day, to see how herd immunity is working or not working. So again, I'm disappointed in the opposition party. There's been lots of problems within the Greek health service, like in the UK health service, that have never been addressed since time immemorial. How many years have you heard the same phrase? Oh, the health service is under pressure this year. The health service under pressure this winter. We hear this time immemorial because the basic problems have not been fixed in the first place. And also, there is no thought about actually, let's grapple those basic issues before we worry about the likes of the COVID coming along. The COVID is being made an excuse for the inefficiencies in the system that were there in the first place. And probably in some ways, it's convenient that we now highlight those inefficiencies, but we use COVID as the excuse. How many people, either in the UK or in Greece for that matter, or any other European country, went for help for cancer, other illnesses, only to be told, sorry, we can't treat you at the moment. We're too busy fighting COVID. So again, it just, I'll leave it there anyway. Anyway, moving on again to another story. The Greek Prime Minister Mitsotakis has written a letter now to the European Commission head, Ursula von der Leyen, to propose that COVID vaccine booster doses be considered as a condition for free travel across the European Union for citizens over the age of 60 as cases surge. Anyway, such a measure, Mitsotakis says in his letter, must be reflected in the European Digital Certificate and in a delegate act concerning the validity period of the European Digital Certificate that the EU's executive arm plans to adopt this week concerning free movement within the bloc. Well, at the moment, free movement within the bloc, at the moment, you can travel as long as you have your PCR test before you go, 48 hours, 72 2 hours. Obviously, the UK is now different because UK is not part of the European Union anymore. To be honest, Brits have had difficulty coming in some respects simply because of the 90-day restriction for staying. We spoke to somebody this morning that's coming over from the UK to stay. In fact, two people that we know coming over to stay from the UK, and they're getting here without too much of a hassle at the moment. Whether they'll have to isolate or anything else like that when they get here, or whether they just having the two jabs means that they could get here without any trouble. I don't know that detail of these people, but people are still coming. People are still opting to stay. But at the moment, Mitsotakis has been pushing this passport, this vaccine passport since last year. It's his big hurrah with his reputation within the EU that he still wants it. But interestingly, a lot of the other EU countries didn't want it. They would say, no, we don't want this. This is smacking of ID cards, European ID cards. But anyway, he says, I've lost my train of thought here now. Anyway, such a policy initiative will help our health systems to cope more effectively with a heavy winter of hospitalizations, but also sustain control over the virus and the pandemic without moving to the new horizontal restrictions that would put in jeopardy the recovery of our economies and the freedom of movement. Listen, the biggest mistake made was the lockdowns, the closing of economies has basically just reinforced and made the situation of lockdown worse last year. At the moment, you can see there are certain groups of people who are just wanting another lockdown, mainly those people who are in jobs where they're probably working from home. They're still getting 80% of their wage if they do get locked down. And for some of these people, the comfortable people, they are the ones who just are difficult to get back to work. People like myself will have to go out, have to do gigs, do entertainment, etc., etc. Those were the people that, again, are not wanting a lockdown. And also, just a thing to reiterate with the UK, they brought mandatory masks in, that starts today, to be worn in public transport and in shops. Yet you don't need to wear masks going into bars, cafes, restaurants. And you can go in there, hug, kiss, see all your mates, and you've got no restriction on you. So again, it's this like craziness of, one, are masks really effective, or are masks just a way of just outward signaling that we are doing something? But at the end of the day, you've got to wear a mask in a supermarket, but you don't have to wear a mask in the Witherspoons at the end of the road. And also the fact that even the supermarkets are saying, listen, our staff got such a hard time last time that you want us to impose these restrictions on people. I think some supermarkets are going to say, do you know what? We're not in it for this to be policemen making sure people have got their masks on or not. So again, it's a compounding of different messages. And again, in England, Boris says one thing, the science says another thing, and then the government itself, as in the MPs, part of the cabinet, they're saying something else. And so there, again, this round of confusion that's going on. And again, the opposition in England, the Labour Party, still just rubber stamps anything to do with COVID and just lets it go through without any questioning. Oh, and can I say that one MP yesterday in the House of Parliament, I'm trying to remember his name, I think it could have been Steve Baker, who stood up and basically obviously went against the party whip and voted against the measures from the British government. He was the only one voice in 360. And again, I'm going to be interested to see what will happen to him. I don't think he'll be deselected because he's very popular in his own constituency, and his constituency is one of the key constituencies as far as the Labour Party is concerned for their bigger running of their party. But anyway, we'll wait and see. I'm digressing there. Right, listen, I think I've given you enough news. I think I've ranted on enough. I know there's a lot of comments here. I've seen Rocky Regan. Can I just say hello, mate? He says, mate, please do you research. You're spouting unsubstantiated information. Be careful, my friend. You're an expert. Follow the science. Yeah, Rocky, I agree totally with you in some ways. However, I'm not quoting the science, but what I'm quoting is the principle of the matter, which is my choice for my body as to what I do. And governments coming along and telling me you're going to do this, you're going to fine me, you're going to do this, that and the other. That is what I'm against. And there's a lot of people now. And some of the science, I've got to be honest, last year it was all conspiracy theory. And this year, after what's gone on, Dr. Fauci, for example, it has been shown that there is an element of truth in it. So again, I do my research. I do a lot of checking and a lot of reading up from all over, not just through the mainstream, but through also independent accredited media sources. Spectator is one, Daily Skeptic is another. Again, check those two areas to see if there is anything, check those two sites if you don't know about them already, Rocky, all right? And cheers for that, mate. Also, as well, haven't anybody else left any comments that I can read? I can have a look. No, I can't see. That's annoying. There's certain comments that, again, I want to read, but I can't see them at the moment. Anyway, take them to the Court of Human Rights, as it's still your right, was the last word from somebody. I don't know who wrote that, but thank you anyway. I think Tim Crystal, thank you for that, Tim. Right, that's it from me. Again, I'll keep my ear to the ground. I do like the comments, whether they're good or bad. You would still be well-being, you still being well-being at our house, jabbed or not. Thank you, fella. I appreciate that. Do you know what? I don't give a toss. I just know I feel what is right, and it is my right to choose. So I'm not going to bang on about that, but I'll keep my ear to the ground. I'll see what people want to say. Leave your comments below. Also, please, on YouTube, again, where all my broadcasts are stored there, you can go and read those, cross-check them, again, put those. And thank you to Rosewood. Well said, Ginge. Thank you myself. Anyway, I love a bit of controversy. It what makes the world go round. And again, I'll speak to you again later. You take care. Ta-ra.